All right, we're going to wait a couple minutes as people slowly start coming in from the previous session. All right, let's get started. So welcome to today's session. Today's session is brought to you by Touro University's Doctor of Physical Therapy program and dual degree of Bachelor of Science, Master of Science of Occupational Therapy with 2 accessible locations and expert faculty. You can become a sought-after licensed OT or PT in just 3 years. So just to introduce our speaker today, Stacey Rosen graduated from Muhlenberg College.
Is there some feedback?
Yeah, I think there's feedback.
Interesting. All right, attendees, give me 1 second while I fix this. Hi, Dr. Horbat-Chewitz, it's coming from your end. Okay, we should be okay for now. Just if you have another window open, make sure that is closed, that maybe has the YouTube or a different channel on. But Ting, go ahead and take it away.
Perfect. Okay, so great transition to introducing our first speaker, Stacey Rosen, who graduated from Muhlenberg College with a major in sociology. Stacey currently transitioned over to higher education, recruiting future healthcare professionals. Currently, Stacey is the director of recruitment for occupational therapy and physical therapy at Touro University. Dr. Jill Horbat-Chewitz is the chair of Touro University's physical therapy department. She has been a member of numerous other college state committees, such as Middle States Accreditation Task Forces. She also has presented her research related to physical therapy and treatment in many national conferences. And lastly, Dr. Linda Rini has practiced occupational therapy clinically since 2003 with populations ranging from pediatrics to geriatrics. Dr. Rini is currently an assistant professor in the Department of Occupational Therapy at Touro University. Please give a warm welcome to Stacey, Dr. Horbat-Chewitz, and Dr. Rini.
Hi, everyone. Hi, Jen. Thank you so much for that lovely intro. Really appreciate it. I'm Stacey. These are my colleagues, Jill and Linda, Dr. Horbat-Chewitz and Dr. Rini. And we're excited to talk to you about Touro University, both our Doctor of Physical Therapy program, as well as our Master's in Occupational Therapy programs. I'm going to share my screen and get our PowerPoint ready to go. So a little bit of a rundown of our time together. I'm going to speak a little bit here at the beginning, a little bit about our applications and what we're looking for and what Touro can offer to you. I'm not going to speak too heavily on it because we are at the sponsor expos all 3 days of this lovely conference. So if you have more in-depth questions about applications, I will be there at 1:15 Eastern Standard Time each day coming up. Then we're going to split time between PT and OT. And then we're going to have time for questions at the end. And I think you can put all your questions in the chat or give them to Ting, and we will make sure to answer all of them. So let's get started. Again, well, thank you for joining us. We're from Touro University School of Health Sciences. This is us here. I also let you see our other department chair for our occupational therapy program. A little bit about Touro University and what you're going to get. We always like to highlight first our faculty. That's who you will see most of your time, besides the members of your cohort. They are experts in their field, active clinicians in diverse settings and backgrounds. You will get a dedicated faculty mentor who will be your advisor throughout your time. But of course, we encourage you to get to know all the faculty on all of our campuses. Some of our specialties in our departments include neurology, pediatrics, sports, hand therapy, geriatrics, the list goes on. And we are definitely going to help you prepare for all your licensing and certification needs. That way, at the end of your 3 years, you'll be ready and confident to sit in your exam. When you choose Touro, you're definitely going to get hands-on experiences. So you have multiple clinical internships throughout the community. You're going to get that hands-on experiential education. So as you can see here with one of our students, learning how to cut an apple with one hand, right? How to assist in patients' daily living that might look different from how other people use or, let's say, cut their apple. We also have students working to adapt children's toys. So you're really going to get that hands-on opportunity. You also get the other chance to do some research in a field in a topic that really interests you. We have professors who are specialized in research. We also have our wonderful resources at our library to help you with all of that. I will like to say that we do get that hands-on learning because of our small class sizes. So at Touro PT, we will cap it at 35 per campus. We currently offer locations in Manhattan and Long Island, 35 per campus per cohort, and up to 33 for OT. So you're really going to get a lot of time with your professors. We do have 2 accessible locations, Central Islip, Long Island, and Times Square, Manhattan. These are both brand new facilities, so they are fully teched out with everything we need for in-person classes, for Zoom webinars, for practicing for your upcoming clinicals. This is just a little bit about your 3 years to graduate and how you're going to enter. So minimum 60 credits for OT, minimum of 90 credits. And I will say here that our occupational therapy program does have an additional OTD program, but more on that in our sponsor expo. So join us tomorrow on the next day, please. We will take a holistic look at your application. So we're going to ask for recommendations. We're going to ask that you get observation hours under licensed PT and OT, 50 for PT, 40 for OT. You can call up your local clinic, see if they take volunteers, look around. Someone's always looking to teach someone else to be a future OT PT. And of course, we'll take a look at your personal statement, your GPA, and everything is submitted through the centralized application system. If you're not familiar with that, join our sponsor expo and I will talk more about it. All right, I'm going to hand it off to my lovely colleague, Dr. Rini, to talk more about occupational therapy.
Sure. Thanks, Stacy. Appreciate that. I just wanted to welcome everyone here, and I'm going to give you a little bit of an overview of occupational therapy. Some of you may have heard of it. For many, the word occupation does pertain to work in terms of paid employment. However, the first thing I'd like to say about occupational therapy and what distinguishes it is that from our OT's perspective, occupation is all the functional activities and tasks that give meaning and purpose to life. And this includes the physical aspects, of course, as well as the social emotional aspects and the psychological aspects of those functional and meaningful activities and tasks. So OT has a very broad perspective and also allows a lot of opportunity for creativity. And we like to think of it sometimes as a blend of art and science. With that said, you can see by the slides here that occupational therapy does, it's a lifespan profession. We use everyday activities. Again, as I mentioned, what we term occupations to work on activities of daily living. These are, self-care skills and the like, work, education, play, leisure, social participation. Again, the entire spectrum of activity and activities that we do really 24/7. We build skills, and that includes, of course, as I said, physical skills, movement skills, but we work on the sensory aspects, the cognitive components, and social emotional skills. And as I think Stacy mentioned, or someone mentioned at the top of this presentation, the slide, it was you, Stacy, that showed someone slicing an apple with one hand. So we also are trained to work with folks to not only restore function or develop functional skills, but to also help them adapt to things that may not be able to be restored, frankly, and give, again, quality and meaning to life despite some of the limitations they may face. Oh, I'm sorry, you got that? Okay. Did you go back? Okay. Did we? Okay. So yes, OTs are in demand. Baby boomers are getting older. And again, as I mentioned, a lifespan profession, obviously, folks tend to need a lot of, or at least more help as they age. Therefore the opportunities are really endless. We work with patients in direct care, but we also have non-traditional paths to practice OT, right? And again, maybe not so super unique. You could be a private practitioner, own your own business or clinic. There are many consultation and advocacy avenues to pursue. Program development, especially, you will work on some of those aspects in a master's program. And if you decide to go into the post-professional OTD doctoral program, that is what the focus of your capstone project would be to develop programming. Of course, with experience and clinical and professional experience, academia is always another career path for you. And one of the things I've loved about the profession, and one of the things that drew me, frankly, to it all those years ago, was the depth and breadth of practice areas, choosing your specialty or area of focus. You are trained in our program to be an OT generalist. And again, when you go to clinicals, you will focus on one area or another, depending on where you go. And that would be driven by your personal preferences. But the background knowledge that you will receive will prepare you for a career as a general practitioner in the field of occupational therapy. And I mentioned already briefly that we do, and Stacy as well, we offer a post-professional doctoral program at Touro. It involves 1 year of online study over and above your master's level coursework. It is entirely online and mostly asynchronous, so it can be one of the features of it, I will say, is that you can work and be actively employed full-time. Our graduates, are out working in the field while they are pursuing their post-professional doctorate. So it is something that you could, and another flexibility of our post-professional doctoral program is that you can take your first semester of doctoral coursework in your final semester of the master's program, and thereby kind of bundle that first semester into your master's credits, your full-time tuition. And you will then have 3 years to complete the rest of the program. Again, that gives you the opportunity to take and pass your boards and become a professional OT and practice while you finish up your doctoral coursework. So I think it's a really great flexible way to take on a doctoral career path if that is one that you are interested in. I think that is the end of mine, so I will pass it off to Dr. Horbakowitz.
Thank you very much. Can you hear me? Yes. Okay. Thanks, Stacy. Hello, everybody. I'm Jill Herbakowitz. I would like to thank all of the presenters for saying my last name properly because it's a killer. I have been the chair of the physical therapy program at Touro College since 1997. So I pretty much know almost every graduate. Our program started in 1984. So there's a few people perhaps that I don't know, but I pretty much know everybody and remember most everybody's name. Physical therapy is such a rewarding career. If you look it up in US News and World Report, it's always one of those top 10 careers. There was an article that came out a couple of years ago, many years ago now, it's like 2007, but I always cite it. And there was one career that was happier than physical therapy, and that was being clergy. So it's super rewarding and you really get to help people and make a difference. Physical therapists restore function. So we are the movement experts and we provide the hands-on patient care. So the patient may go to the doctor for whatever their issue is, but the doctor is not going to fix it. The physical therapist is going to fix it. So if you came to a physical therapist, they would do an examination. They would look at all the findings and evaluate what they think is wrong. And they would give you a physical therapy diagnosis and plan your care and then execute the treatments. There's also a lot of wellness to prevent things from happening. Sometimes a physical therapist would work with a sports team to condition them so they won't have injuries. And besides the typical job of a physical therapist working in a clinic, there are other people out there that are physical therapists that do other things. So they serve as educators. For example, I'm, a faculty at a university. They can be researchers. They can work in DC as an advocate. Physical therapists consult for business. Maybe they'll consult with UPS for their workers in the warehouse, things like that. And then I think typically when we talk about what kind of people physical therapists treat, many people think about that orthopedic sports kind of physical therapist. And that is the musculoskeletal system, where an example would be if somebody had a hip replacement or they tore their ACL or their meniscus or rotator cuff tear, we would certainly work with that. Physical therapists also work with the neuromuscular system. So if a patient had an injury to their spinal cord or their brain, so maybe a stroke, Parkinson's, spinal cord injury, heart failure in some way, physical therapists work with that. The cardiopulmonary system, so a patient with some sort of pulmonary disorder like emphysema, we can help increase their capacity to tolerate activity. Someone who had a bypass surgery, get them reconditioned, cardiac rehabilitation. And then a little known system where we all have it, the integumentary system. So patients all have skin and sometimes there are wounds. It could be as small as a scar from a surgery. It could be from poor circulation and lymphedema. Physical therapists are trained to help people with lymphedema and fascial restrictions, myofascial release types of techniques. So you really could work with any age and with any diagnosis, and you can change your mind later in your career and mix it up if you'd want to. Next slide, please. So physical therapists' jobs are always in demand. If you look it up on whatever site to see, there is always projected job growth for physical therapists, and that is because the population is getting older and grayer, and there are way more active people a lot longer. So those are our potential patients. What's nice about physical therapy is you can have direct access where a patient can come right to you. They don't necessarily need to go to the physician first. Of course, it depends on what their insurance will pay. But if you have, for example, multiple sclerosis or an ankle sprain, and it's a long-term thing, you can go right to the physical therapist. A lot of PTs open their own practices. There are opportunities to go into lots of different fields. And you can specialize or not specialize. So maybe you're choosing to be a pediatric physical therapist in the school system, or you want to work on Wall Street with people, who like their physical therapy at 5 a.m. Again, it's up to you. Next slide, please. Were you going to do this slide, Stacey?
Yeah, so that was it for
Let me
the
just-
PT stuff. Yeah. let
Okay,
me go back.
so the last few things that I just want to say about the physical therapy program is that, as Stacy said, and it's true for the occupational therapy program also, but one of the really nice things are our class sizes. There are other programs out there that have, 50 people in a class. And by keeping our class sizes small, if you're looking for a program where you're going to get individual attention, it's really quite a plus of our program. And if you speak to graduates, one of the things that draws them here is how the faculty get along, and also how the sort of environment is for the students, where it's rigorous but not competitive. All right, Stacy, I will hand it back over to you. Thank you.
Thank you. So before we get into the question and answers, just a little bit more about what Touro itself has. So of course, you're going to be coming into a great, rigorous, but great program that offers expert faculty, but there's a lot more that goes on to the program besides class. You can join our student organizations, SPTA for PT students, or SOTA for our OT students. We're going to have advocacy days. We did have our OT students, you can see here, go up to Albany with our professors and learn more about advocacy work. You're going to have experiential labs, research presentations, and of course, when you get that white coat, when it's time to celebrate your graduation, we will be there to do it every step of the way. We also will have student ambassadors, so you will have the opportunity to help spread the name of Touro University, work with recruitment, to talk to prospective students, to talk to our accepted students, maybe to be the face of your program for people who are interested in being in your shoes. And we do offer a scholarship in excuse me, what's the word I'm looking for? And joining a student ambassador, there is a scholarship opportunity. And that is it for our presentation portion. So I'm going to leave some room for questions. I have my email here. And our numbers actually just changed. So if you need that, I will actually be changing that very soon. But here's my email here. If you scan this, you will go to everything you need for OT. If you scan this little lovely thing over here, this QR code, you will get everything you need for DPT. So we have a couple of questions in the Q&A. I'm going to read them, Jill and Linda. Dr. Buckworth, Dr. Rini, excuse me, and the answer. So the first one is for Dr. Herbakowitz. So after getting your DPT degree, do you have to do a further residency if you want to specialize like in oncology or pediatrics, things like that? Very similar.
Hi, Landry. So you don't need to pursue a residency. You can pursue a residency. When you go to physical therapy school, we graduate you as a generalist, which means you can go right into any of these specialties because we taught you something about all the specialties. And then when you get there, if you want to develop further, you can pursue a residency. I don't think there is an oncology residency, but there are many residencies. And to look that up, it's the ABPTFRE. That is the American Physical Therapy Association's residency area. And you can see all the different residencies. So an example would be at Touro, we do have an accredited orthopedic residency.
Great, thank you. And so now this one, the famous question, how do the OT and PT professions differ? And if you're maybe interested in both, how could you decide between the two?
You want to take a shot, Dr. Rini, or you want me to take a shot?
Maybe I'll go first because I think there is often a lot of confusion. Our professions do overlap somewhat. We do, as OTs, as I mentioned earlier, work on physical aspects of the person, as well as PTs do. I think Dr. Herbakowitz, so the movement specialists, right? And yes, your training as an OT will include kinesiology and anatomy and physiology, and yes, a lot of what we do does involve physical movement. Where it differs, I would say, is perhaps in our scope of practice. As I mentioned earlier, OT is really, and this is not to say that PT is not focused on people's function. So I don't think that's exactly the right word, but we also look at the adaptive process, the psychological process, the social emotional aspects of occupation. And what we do is always focused on, in fact, occupation. So it almost like, if in simpler terms, if you're looking at a PT as the athletic trainer, then the OT is the coach. I think that might be a fair way to delineate it in very simple terms. So they both have very unique and special qualities. They both, Dr. Horbakowitz spoke well about how it is a helping profession. OT is, as much as PT, a helping profession. But again, we have a bit of a different focus on the functional aspects, and perhaps a broader scope when it comes to the additional elements, if you will, of what make people be able to participate in their occupations of life on an ongoing basis. And there's never a simple explanation for that. Dr. Horbakowitz, maybe you can add a little to it.
I think because there's so much overlap, and truly, depending on where you go, you may see an OT and a PT doing the same thing. But there are things that OTs do that physical therapists don't do. OTs have some work with the psychological aspects of patient care. They have some classwork in that. They also specialize in splinting. Then physical therapists don't really do as much of that. And then I would say that they do work more with the occupations of daily life. Though physical therapists do, it's not as big of an emphasis, if that makes sense. That's what I would say. If that's helpful. I would recommend volunteering for both and seeing what a day in the life is like.
That's great. So that's a great suggestion. And I did mention, I think earlier, also the creativity there are, and which again, I don't want to, I hope I don't want to shortchange our physical therapy colleagues at all. But there's a lot of room for creativity in occupational therapy. And I do hear that a lot from students who have ultimately made that choice. And often we have students who said, I wasn't sure if it was going to be PT or OT, but then as Dr. Horbakowitz suggested, I shadowed, and, I saw, a school-based OT doing crafts with their kids. And that's what, sold me on the profession of OT. So I would say from the creative standpoint, if you are that person, the art and science, where art and science collide, perhaps that would be, you'd be more inclined to go to OT. But yes, shadowing, that's a great suggestion.
Great. Thank you for providing such great insight. And we do have a couple questions that we kind of gathered from our audience. So in regard to applying to an OT or PT program, what is like the top qualities you look for that this applicant is suited for Touro University's OT and PT program?
Should I start with that one? So there are a couple of things that we look at. Certainly we do look at your grades. We look at your grades because it's a difficult program. It's very rigorous. And if you won't be able to handle, let's say, 5 courses at the same time that are difficult, we wouldn't want to admit you only to dismiss you. So we do look to see that people can be successful in the program. And then beyond that, we're looking for a certain quality of student. We're looking for students that have sort of a perseverance to them, and some integrity and some grit. We look to see, if you've done volunteer work. We look to see if you're able to manage your time. Maybe you are working while you're going to school and taking classes. Our program does not interview everyone. We only invite certain qualified people, and then our interview process is different than OT. What we do is we have an asynchronous interview where we would send you a link and you would record your interviews. So we look to see how you communicate, if you're able to think on your feet. We look at your essay, we look at your letters of recommendation. We do ask you to volunteer with a physical therapist, and they're going to fill out a form about you. And if you think about that, we would expect that you will excel. There's nothing difficult about being a volunteer. We want to see that you're on time, that you're, working really hard. We just want to see that you're going to be somebody that's going to represent this profession well, compassionate, want to help people, and also academically strong. So that's what I would say about the physical therapy program.
And I agree with most of that. I do. It's essentially, we look for the same things. We do have a synchronous interview process. And again, if you are selected to be interviewed, there's a screening process. I believe both professions have an application process that begins with a centralized system. You have to upload your own personal statements. So of course we that's our first glimpse at you, as well as your grades and transcripts. So yeah, we want to see, we want to hear your voice when you write those essays, and why you are interested in the profession. Again, not to reiterate too much, but most of what Dr. Horbakowitz said, your volunteer experience, your timeliness, your grit. I love that word because it rigorous. Yes. Challenging. Yes. Many people have done it. And if you have the will and determination, so can you. But that will and determination maybe separates who can and who doesn't. So that has to be reflected in your applications and in your interviews. And that's how we get to know you at the outset.
Thank you. Thank you for providing such a great kind of like a transparent look on what are the top qualities to be successful as an aspiring OT or PT. And so kind of following on along that, is there a recommended experience you would like all or most of your applicants to think about to do before like jumping into doing the application for OT and PT program?
I'll let you go first this time, Dr.
Okay, thank you. Volunteer work, shadowing, we do require in the application process, and you'll see that in the centralized process, that you do have to have hours of I guess observation experience, and perhaps you are a person who has had paraprofessional experience, right? Many students have worked in clinics, and even some of our OT students have worked in clinics where PT is provided, and they get a sense of what it's like to work with patients. So yeah, those are some of the other things that we would want to see in terms of having some idea of what you're getting into, I suppose. It's not like, oh, this sounds great, and let me give it a whirl. I think you should be well prepared to know to some extent, at least, what you're getting into before you take the plunge.
So the question was what activities they should do before coming to physical therapy school. Well, I think really all we ask of you is to do 50 hours of volunteer time. And really some of that is to expose you to the profession, to make sure that this is something that you want to do. And another nice reason to have that is that when you're in class, you will think about, oh, I saw a person with a stroke, and I can put some context to what I'm learning now, or I saw someone on crutches, and now I understand why you teach them to walk in this manner. We don't ask a lot more of you other than the specific prerequisites that you can find on PTCAS and on our website. We don't want to make too much of a burden, but you should know that this is what you want to do. And of course, having some knowledge of anatomy, we require you to take that before you're admitted, but taking it and remembering it are two different things. So it's very helpful to have that foundation before you come, even though we're going to teach it to you again.
Great. Thank you so much for giving that kind of, I really like the aspect when you said it's really about getting an exposure to know that you're getting into what you want to do. So because mentioned in the presentation, OT and PT are really about movement and like really the muscle. That's like sometimes we get injuries that are preventable. And so is there an issue that you see often on the rise in OT or PT that can be preventable? It doesn't have to be taken to the most serious aspect that people should be aware of.
That one's yours, Jill.
I was going to say, you're going to make me go first now, aren't you? Well, first of all, these questions are fantastic. I'm sure nobody's asking them, but they're thinking it. So prevention is really important, as is wellness. In general, there are so many things that'll happen to you later in life if you are overweight and if you don't exercise. So all of those types of diseases like diabetes, heart attacks, and strokes are preventable by keeping a healthy lifestyle. But in terms of other preventative things, people sometimes are those weekend warriors and they just wake up and decide, I am now going to play pickleball 24 hours a day, and everybody's tearing their Achilles tendon, or they're, giving yourselves tendonitis in their shoulder. So sometimes you need some form of strengthening or stretching prior to beginning these types of activities, and it's nice to ease into them. So both of those would represent typical types of things that are preventative.
And OTs do also have an emerging practice area and a current practice area, but one of the trends in OT is toward health and wellness. We have a pretty broad scope. So in our social, emotional, psychological, as well as our physical toolbox, should I say, we focus on health and wellness, and that includes prevention, and it also includes looking at people holistically. So even folks who come in with already sustained injuries or who have conditions, perhaps lifelong conditions, as well as acquired conditions, can still live a high quality of life. So health and wellness, as well as prevention, are areas of occupation, what we call areas of occupation, that we would also focus on in OT. And again, it's setting dependent. If you're working in acute care, that's probably not what your focus is going to be. But maybe if you're working in a more general setting, or in a private practice, or even with children, who have a wide variety of pre-existing conditions, you can work with them on, again, maintaining a high quality of life and trying to prevent further injury, or again, just maintaining a high standard and quality of life.
Thank you. So our last question, kind of like a fun one to kind of wrap up our Q&A, is what point of your life made you determined, or an experience that made you determined, I want to go OT or PT, or why you decided that this is the career for you?
All right.
My dog just started to bark, Jill, so if you don't mind going first on this one.
Sure.
Thank you.
This is a great question, and sometimes it's something that we ask our applicants. We say, why do you want to be a physical therapist? And I will tell you that many people go into this field because they want to help other people. I'm sure that is true for almost all of healthcare. And then we find that a lot of people have either been injured and had an experience with a physical therapist, and they just see what they're doing and they aspire to do that, whether they're a high school or college athlete or something to that effect. And then the other aspect is if a family member has needed a physical therapist. So somebody's grandfather had a stroke or someone's sister had cerebral palsy, and they see what a difference the physical therapist has made in their life. Those are really the reasons that people go into this. When I went into this was a bachelor's degree. I did this, I was in school and I heard about this fantastic profession where you didn't have to sit behind a desk. You could help people, you could be active, you meet lots of people. It's very social. And that's really why I went into it. I probably didn't know as much as I should have known, but it's really just a fantastic career.
Thanks. She stopped barking, so I'm good. So I echo Dr. Horbakowitz's sentiments in that, we often and almost exclusively, and no one comes into either of our professions because, they like pushing pencils or, adding numbers. They want to help people, which obviously is the most rewarding thing a person can do. So yes, personal experiences, either self or family members, draw people to the profession. I personally came to the profession later in life. It was my second career, if you will, after I had done other things and raised a family and was kind of like, what should I do next? And that's how I came to be an OT. And it was a low, it was a bachelor's level at the time as well. Whatever, I won't get into the specifics of that, but in any case, I kind of said, oh, let me give it a try, which was, I don't know, such a great thing. But in any case, it turned out to be the magnificent career that I hoped it would be, and something, frankly, that I can do into my later life. I don't plan on retiring anytime soon. There are people who are my age, frankly, who are looking to stop working. And I am not, because what I am doing now, thankfully, is I've eased a little bit out of clinical work and into academia, where I can pass the torch, so to speak, onto folks like you, which gives me a rare and wonderful opportunity to continue in my profession and work probably less clinically and more academically, yet still be immersed in the latest and greatest of what's happening in the profession. And again, sharing my clinical experience and knowledge with the next generation of practitioners, which is so gratifying. And again, I know you folks are probably all, just beginning your careers, but it is something that can be a lifelong career for you as well, because there are so many opportunities in both of our professions, PT and OT, to practice throughout your adult life.
Great. Thank you so much to Stacy, Dr. Rini, and Dr. Horbakowitz for such an amazing presentation. That wraps up our session today about learning with PT and OT. So we'll transition to our next session with PA.
Bye, everybody.
Thank
Bye,
you.
everyone. Thank you.